Hi, I'm Dr. Patel. I'm co-medical director here at Highlands Rehab Hospital in El Paso, Texas, part of the Vibra Health system, and March is Brain Injury Month. So we're going to be talking a little bit about traumatic brain injuries, sometimes usually abbreviated as TBIs. So surprisingly, there are a lot of brain injuries that happen. It was estimated that there are about 2.8 million TBIs annually. Fortunately, most of them are on the milder side, and 90% actually end up being released from the emergency department. However, about 282,000 do need to be hospitalized, and different demographics have different risk factors for sustaining brain injuries. More specifically, different age groups, such as those who are young from 0 to 4 and those who are older, 75 or older, tend to get brain injuries from things such as falls, whereas middle-aged or younger people from age group of like 20 to 24, sometimes in the 30s, tend to have more brain injuries from motor vehicle collisions and accidents from that sort. Another thing that would be important to mention is that children also can suffer from brain injuries from sports-related or recreational purposes as well. A lot of concussions from that. So things to keep in mind is prevention. So first things first, if you're a young athlete, always wear your helmet, have these discussions with your primary care or family doctor, talk with your parents, things about that. And then also, if you are ever in a vehicle, always buckle up. If you're riding a motorcycle, always wear a helmet. Safety first. It will help you in the long run. And then for our biggest demographic that we see at our hospital here at Rehab are patients with falls. Not only can you sometimes sustain traumatic brain injuries from falls, but also broken bones. And these are situations where we can help and improve people's functional status after that, but ideally it wouldn't happen in the first place. So things that you can do to prevent that, we have a therapist here, Petra, who has put together a fall packet for our patients. So we're just going to go through that a little bit. So some things that you can do is just make sure that you have adequate lighting in your home so you can see where you're going, have night lights. Rugs, I generally just have don't have a rug policy because they are tripping hazards, but if you do choose to have a rug, try to make sure that you have like a non-slip adhesive under it or some sort of thing so that it doesn't slip under you. Also, don't run cords under it because it'll make it uneven and then you could trip off that. Making sure you don't have like objects lying around, such as in the hallway that you can trip over. Always wear proper shoes. Slippery, sorry, that word is slippery. Slippery surfaces such as the bathroom floors should be protected by having mats. Also, having handlebars or grab bars installed in the bathroom, it really helps with preventing falls in the bathroom as well. And then other things that you can also do is have your eyesight checked regularly, and just overall, safety first. Just try to be careful when you're moving around if you're reaching for a shelf, don't have shelves be too high, because if you're trying to reach, you could fall for that. But otherwise, just try to stay healthy and exercise, things like that to prevent falls. And if it does happen, call for help, and then maybe we could help you in that situation too. But it's been a pleasure speaking to you. I hope you all have a wonderful day.